Have you ever worried about your rabbit having a tummy ache?
Mm.
Today we're doing a deep dive into something far more serious, something called gastrointestinal stasis, or GI stasis.
Mm-hmm.
It's critical for anyone with a rabbit or even vet students to understand this because it's potentially life-threatening and things can go downhill incredibly fast.
Absolutely. And the key thing to get right away is that GI stasis isn't usually, a disease on its own. It's more often a symptom.
A symptom?
Yeah, like a big warning sign that something else is wrong. A rabbit's digestive system is, it's incredibly delicate. They're hindgut fermenters, which basically means the main digestion happens way down in the large intestine, not really the stomach like us.
Okay.
And it relies on this really complex balance of bacteria and constant movement. If that gets disrupted, everything can just grind to a halt.
Wow, okay. So grind to a halt. What's actually happening inside them when stasis hits? What does that look like?
Well, essentially the normal movements, the sort of wave-like contractions of the intestines, we call it gut motility, they slow right down or sometimes just stop completely.
Right.
And when that happens, harmful bacteria can multiply really fast. This causes a lot of gas, which is incredibly painful bloating for the rabbit.
Ouch.
Yeah. And then, naturally, they stop eating, stop passing droppings. And the really scary part, this whole situation can become fatal sometimes in less than 24 hours if it's not treated.
24 hours? That's terrifyingly fast.
Yeah.
You mentioned they hide illness too, which must make it harder.
They do. They're prey animals, so it's instinct to hide weakness. That's why spotting the subtle signs is so, so important.
Okay, so what are those subtle signs? What should you be looking for, even if they seem okay at first glance?
Well, often they'll just be quieter than usual, maybe sitting hunched up, not wanting to move much.
Right, lethargic.
Exactly.
Yeah.
Then there's the appetite, reduced interest in food, or maybe not eating at all. And critically, look at the droppings. Are they smaller than usual? Fewer, or maybe none at all. Sometimes you might see soft droppings, or ones covered in mucus. Those are all red flags.
Any other signs?
Yes. Teeth grinding, that loud grinding sound, is a definite sign of pain. And sometimes you might notice their tummy feels bloated or hard. That's the gas buildup.
Got it. So understanding the signs is key. But what actually causes this whole system to just shut down? What triggers GI stasis?
The most common cause, honestly, is diet. An improper diet.
How so?
Specifically, not enough fiber. Rabbits need a diet that's like 85–90% high-quality hay.
Yeah.
And it's not just for the fiber itself, though that's crucial for gut health. It's also the act of chewing hay. That constant grinding wears down their teeth, which grow continuously, and it physically stimulates the gut to keep moving.
Ah, so it's doing double duty.
Precisely. Too many pellets or sugary treats and not enough hay is a recipe for disaster. But it's not just diet.
Okay, well.
Stress is a big one. Changes in their environment, losing a bonded partner, even loud noises.
Like fireworks you mentioned.
Exactly. Fireworks, construction noise. Pain is another major trigger. Things like dental problems, overgrown teeth, abscesses, those are really common underlying causes. Or arthritis, urinary issues.
Makes sense. Pain would make anyone not want to move or eat.
For sure. And then there's dehydration, not having enough fresh water available. Lack of exercise can slow things down, too. And sometimes there can be an actual blockage, like a hairball, especially in long-haired breeds, or if they've eaten something they shouldn't have.
Wow, okay. So quite a few potential culprits. If you suspect GI stasis, what happens when you get to the vet? What's the diagnostic process like?
Well, the first step is always a thorough physical exam. The vet will feel the abdomen, check their temperature, listen to the gut sounds or lack thereof. And they'll ask you lots of questions about, recent changes in appetite, droppings, behavior.
Right, the history.
Exactly. Then, very often, they'll recommend x-rays. This helps check for gas patterns, the extent of the slowdown, and crucially, to see if there's an obvious blockage. Sometimes blood tests are needed too to check for dehydration, infection, or clues about other underlying problems like kidney or liver issues.
And you said acting fast is key.
Crucial. Waiting even a few hours can make a huge difference in the outcome. It really is an emergency.
So assuming it is diagnosed as GI stasis, what's the treatment plan usually involve?
Treatment needs to be aggressive and supportive. Fluids are almost always step one, often given under the skin or intravenously to combat dehydration. Pain relief is absolutely essential because pain itself makes stasis worse.
A vicious cycle.
Exactly. Then there are medications to help stimulate the gut to start moving again, often called prokinetics. And nutritional support is vital. If they're not eating, they need to be syringe-fed a special high-fiber formula.
Force feeding, basically.
Well, assisted feeding, yes. It's critical to get calories and fiber into them. And of course, you have to treat the underlying cause if one is identified, like dental work, if that's the problem, or adjusting the diet long term.
What about surgery? You mentioned blockages.
Surgery is really a last resort, typically only if there's a confirmed physical blockage that won't pass. It carries significant risks because these rabbits are already very sick and fragile. The prognosis is generally poorer if surgery is needed.
Understood. So given how serious and scary this all sounds, prevention seems incredibly important. What are the best ways to try and stop GI stasis from happening in the first place?
Prevention is definitely the goal, and it really comes back to those fundamentals. Number one, diet. Unlimited access to high-quality grass hay. That's the cornerstone.
Hey.
Absolutely. Then plenty of fresh water offer both a bowl and a dottle, as some rabbits prefer one over the other. Make sure they get lots of exercise, time out of the cage to run, jump, explore. That keeps the gut moving.
Good for their minds too, I bet.
Definitely. Regular grooming, especially for long-haired breeds, helps reduce the amount of hair they swallow, lowering the risk of hairballs. Minimizing stress is important too, providing a stable, calm environment.
And vet checks.
Yes, regular vet checkups, at least once a year, are key. They can catch things like early dental disease before they become serious enough to trigger stasis.
This has been incredibly insightful. So the main takeaway seems to be GI stasis is a genuine emergency. Every hour matters.
Without a doubt. If you suspect anything is wrong with your rabbit, if they seem off, aren't eating, aren't pooping normally, don't wait. Contact a rabbit-savvy vet immediately. Because they hide illness so well, by the time you notice signs, it's often already quite serious.
A really crucial point. And just a reminder to everyone listening, this deep dive is aimed at providing valuable information and understanding. It's purely for educational purposes.
That's right. It's definitely not a substitute for professional veterinary advice or care. Always consult your vet for any health concerns with your pet.
Keep learning. Keep observing your furry friends closely. And here's to keeping them healthy and happy.